All right, so you submitted your claim for a mental illness disability after your service, and here is what you can expect during your CNP or Compensation and Pension Behavioral Health exam. All right, hi up there, I'm Dr. Roxana Eubanks. I'm a licensed psychologist and I do disability assessments for veterans. And so, of course, this is going to depend on the company or the organization that is conducting the exam. But here is what you can expect during these exams. All right, so you're going to come in. We have access to your claims file. So everything that's already included there in terms of your service treatment records, your entrance exam, your DD-214, all of that, and of course your medical records after we have access to. All right, so we review them and then we ask you questions pertaining to that. So if you ever had a mental health intake or evaluation done, it's going to be a little bit similar. So we're trying to get some history about growing up, how your mental health was, if you had any mental health issues before your time in the service, you know, how your childhood was, how your grades were in school, as well as family history. So is there any substance use in your family history, any mental illness that you're aware of? And then, of course, occupational things like what kind of jobs you worked before your service. While you were in the service, did you get along well with others? Were there any significant issues like Article 15s or anything like that? And then after your time in the service, so what kind of jobs have you been working? Have you been getting along with your supervisors and your coworkers? Things of that nature. So as you can see, we kind of jump around a little bit to your life before the service, during, and after, okay? And so when it comes to while you were in the service, we're gonna ask, you know, were there any difficult things that occurred? And a lot of times, if you are submitting a claim for PTSD, you're asked to write a statement in support of PTSD. And there's a section there where you talk or you list some stressors or some traumatic experiences that you had while in the service, when they occurred, where you were when they occurred, and things of that nature. So we'll ask just a little bit more information. I know that's really overwhelming for people, especially having to disclose these things for the first time. So I always tell the veterans that I'm meeting with that for the purpose of this exam, we don't need to go too in-depth into the traumatic details unless they're comfortable. I just, for my purposes, need to know, you know, what occurred, around a rough timeline of when it occurred, if there's any supporting documentation, and how it's affecting them now. All right, so that's all kind of before your time in the service, during, and then we get to the after. So of course, like I said, if you completed any additional education after your service, what kind of jobs you've been working, what does your social life look like now? Are you single? Do you have support? Do you get along well with others? Are you in contact with any people that you served with? Things of that nature. And then, of course, what are your mental health symptoms now? Have you received any mental health treatment? If so, where? Are you currently prescribed any psychotropic medication, or have you been in the past? And then we'll, of course, ask a bit more specifically about your symptoms and how they manifest for you and how it impacts different areas of your life, like your sleep, your appetite, your relationships. And then sometimes examiners will give you a few like self measures pertaining to PTSD symptoms, depression, anxiety, things of that nature. And then we also have a section where it talks about your legal history. So if you've ever had any legal problems before your time in service, during, or after, as well as your substance use history and what that looks like for you. So of course, the exam, it's going to vary depending on the facility and the provider. But that's typically what you tend to expect in a initial behavioral health CNP exam. So if you're already service connected for a mental illness and you're trying to get an increase in your rating, then that would be a review exam, which focuses on just since the time of your last exam, how your mental health has been. But I can post a separate video on that. All right, let me know if you have any questions. And of course, this varies, and this is just for education purposes only. There's so much great information on va.gov if you have specific questions. All right, take care.